Hello, I'm Dr. Mark Fitzgerald, and I'm here today to talk to you about dentistry from the perspective of a private practitioner. My qualifications for this discussion are mainly the fact that I've practiced dentistry for over 30 years. Today we'll try to cover 4 different objectives: the scope of dentistry, what do we do as practitioners in dentistry, what are some of the emerging frontiers, and we will start with how do you get into the dental profession. So becoming a dentist, the dental curriculum is a rather difficult curriculum to accomplish. It's a 4-year program. At the School of Dentistry here at the University of Michigan, we actually offer 3 dental degrees. One is the first one, which is a Doctor of Dental Surgery, the DDS, and most of our students elect that program. We do have 2 other combined programs that are available, and around 2 to 3 students will select these programs. So one is the Doctor of Dental Surgery, DDS, with a master's degree in some type Masters of Science in usually public health, or we have just recently started a program with the business school, and then also they can get a DDS with a PhD. But the basic 4-year program starts in the summer of the first year and continues year-round until graduation at the end of the winter term in the 4th year. And credit load ranges from 24 to 34 credits per semester. The clinical experience for this program starts in the first year in the fall semester and increases from year to year, so that by the time that they're a 4th-year student, they are in clinics at least 6 half-days a week, and they also, during that final year, spend 12 weeks of clinical experience in clinics outside of the dental school that are distributed across the state of Michigan, serving underserved populations. And the 4th year includes 12 weeks of clinical experience in clinics outside of the school. A newly graduated licensed dentist can legally practice independently in any setting. And after graduation, there is a diverse array of options for dental practice that range all the way from going back to those community clinic settings that they experienced in their 4th year, all the way to owning their own private practice with other opportunities such as healthcare systems, corporate dentistry, group practices, private practices as an employee rather than an owner, or an academic. A general dentist actually has a wide range of services that they can provide to the population. When licensed, a general dentist can perform all types of dental services. There are 9 different specialties in dentistry, and if a graduate from a DDS program chooses to specialize in one of those specialties, then they have to go on for continuing education in a specialty program that generally ranges from an additional 2 to 3 year commitment, sometimes up to 4 for oral surgery. But a general dentist also then serves as the primary source for referral to these specialists. There are many different hats that a general dentist wears. They wear the hat of a communicator, a business person, a dentist, and also a community leader. We'll take a moment now to look at these different hats that the general dentist wears during their career. From a communication perspective, we communicate with a lot of different individuals, including our patients, but also people outside of our patient realm. But what patients in particular tend to want, according to a study done in the mid-1990s, is that patients want to have clear expectations and instructions about what is happening to them and what to expect during that treatment, what to do in order to make that treatment or that interaction successful. They want appropriate answers to questions that they have. They want to feel that they've received personal attention. They want to feel that that interaction has actually a genuine concern behind that interaction. They want courteous telephone exchanges. They want warm, friendly staff. And they want explanations for any delays that may happen. So although these communication expectations do not seem to be particularly challenging, they are very important, and we as dentists need to be very aware of these needs of our patients. From a business perspective, first of all, a dentist needs to be an entrepreneur. They need to be willing and able to take risks. They need to be able to create ideas and come up with solutions to business problems and opportunities. They need to be a problem solver, and they need to know how to identify a problem, identify potential solutions to those problems, and then come up with ways to implement solutions. They need to be a leader of their dental team. A typical dental team in a private practice is the dentist, one or more dental hygienists, one or more assistants, and one or more people at the front desk. So a minimal profile for a dental practice would be to have the dentist and 3 other individuals, but generally there are more than that are involved in the practice itself. And the dentist is the person who's responsible for making sure that they work together as a well-functioning, cohesive team. They also need to be a financial manager. There's a lot of financial aspects to running a business in general, and then in dentistry in particular, there are lots of financial issues that surround the realms of being an employer, of dealing with dental insurance companies and billing and collections from patients, and also dealing with outside providers and consultants that help the practice run smoothly. The dentist itself, he or she needs to be a very good diagnostician and also a surgeon, thus the title Doctor of Dental Surgery. So as opposed to some other professions where the prime responsibility is diagnosis and recommendation of types of treatment, the dentist gets involved very much into a day-to-day activity that involves surgical techniques in very confined areas with very precise dimensions that they're working within. And so this can be a very demanding practice or demanding profession. From the community leader perspective, society trusts dental professionals. And because of that trust, a dentist, when they go into a community, will find themselves often being called on for leadership roles. These leadership roles can range all the way from being involved in PTOs, churches, the government of churches, also local governments, and business organizations. Some of the exciting emerging trends, or one of the most exciting emerging trends that I see in the future of dentistry, is in the area of interprofessional collaborative care. In this arena, there's a new initiative that is growing among healthcare to involve collaborative teams of different professionals to help to provide for the care and well-being of patients, families, and populations. And so we find ourselves in the dental profession becoming more and more involved with other healthcare providers like physicians, nurse practitioners, pharmacists, social workers, physical therapists, occupational therapists, to collaborate with them to provide the best overall care, advice, and management for our patients. We find that our patients are coming to our practices with a greater array of complexity in terms of their general health needs. And we're also finding that oral health has a much more critical role on general health than had previously been recognized. And because of this, we're being called into these care teams more and more often now. And this is an area of new and expanding opportunities for dentists. So in summary, I have found dentistry to be a very rewarding profession to be in and a very exciting profession to also be involved with. It has continuously evolved over the 30-plus years that I've been with it. I expect it to continue to evolve and to grow and to provide new and exciting opportunities for those who choose the profession for their career.